I'm Naya. I live in Eagan, Minnesota. I live in a shelter currently called Dakota Woodlands. Sometimes you can't catch everything that comes your way. So I just sum it up to life, and I can't say poor choices because I had a full-time job. I was doing everything I was supposed to do. It's just like a curveball somewhere. Yeah, but that's what brought me here. People come in like scared to talk about health, and some people scared to just express even. People do need these resources. They need to know that it's out there, that it's available, that it's free to get. That's the main thing. It's free, it's no cost. Kids getting sick, it's flu time. It's like, you need someone on hand like, okay, we can do this. Yep, sometimes that take a toll on people when you don't have those health resources and you let when people find out they got cancer, sometimes it's always at the end because they was too scared to say, no resources. When you don't have medical, people think like, oh, you can't go to the doctor. There's nothing out there. And all the time it is. It's people like you guys that come out and give us the hope and like, okay, let me go get this tea poured out. I don't have to hurt anymore. It's a resource that they just showed me. But to be as well is to be alive.
Leah Roberts, Public Health Supervisor at Dakota County Public Health. Our populations that we serve include pregnant women, young families, the elderly, as well as anyone else who might need our services in the community at large. CHWs have a huge impact in our community. They are often members of the communities that they're serving, so that helps garner trust and help bridge a gap between county services and the community. They're able to meet individuals where they're at in order to give them more health literacy, as well as empower them to take control of their own health and access resources that are available to them.
Community health workers connect individuals with things like funding for adjustments in the home, grab bars, wheelchair ramps, anything that would allow an individual to have a better quality of life if they're able to stay in their home. Community health workers support nurses by providing health education and working with individuals so that they're able to self-manage their illnesses. Community health workers are also able to complete intake processes alongside an individual to help advocate for what those needs are. Community health workers can assist social workers with providing access and connection to different community resources and programs. In both scenarios, the community health worker's support really frees up the time for a social worker and a nurse to be able to provide support and services to individuals that are not included in a community health worker's role and scope of practice.
I help with the family home visiting team. I'm just making sure that they have resources, that they know how to utilize their insurance, and do car seat education as well. Not just focusing on family home visiting, but just like the community as a whole. I work with a client who needed resources, a public assistant, resources like clothing, food, baby clothing. And so we have organization that we work with, and just being able to shop for like their needs. I'm just really happy that I'm able to help.
My name is Maria Torres Castillo, and I'm with Dakota County Public Health. And the populations that we serve are actually, it's a diverse population, focusing, of course, on our targeted population, our Spanish-speaking population. However, we do help everyone in the community. I also have the opportunity to be part of Dakota Woodlands. It's a shelter where I partner with a public health nurse, and we do our outreach events. And the goal is also to be able to provide those resources, programs, and services to this community as well, so that they know that even though they are in a shelter, they still have needs and there is help available too. Some of those needs or resources that we may be able to fulfill during our outreach events is connecting our community members with resources such as food. And so we are able to connect them to food banks or other organizations, clothing, insurance. We also connect them to medical, and also the benefits that the Challenging Checkups program provides, such as getting appointments scheduled, assistance with finding a clinic, transportation, interpreting services. A lot of the community members do not know that these perks, incentives are available for them through their medical assistance program. And so this is what we try to also emphasize,
I've been working as a CHW for 10 months now. I received my certificate at St. Catherine's University, where at the time I was also getting my degree in public health. Before becoming a CHW, I was a child welfare specialist. And prior to that, I was also working for the COVID-19 projects in the state. What inspired me to become a CHW, I would say, is my parents. I am a daughter of an immigrant parent, and so just seeing and experiencing like the struggle that my parents go through really gave me the motivation and inspiration to help the community navigate the system, the healthcare system, just the language barrier as well as my motivation to work with the community.
I've been a CHW since 2017, so going for 10 years. I got my CHW certificate at Summit Academy back in 2017. I actually never left my previous role. I've been in the medical interpreting field for roughly over 20 years. And one of the things that actually prompted me to become a CHW, just as an interpreter, we abide by standards of practice and our ethics. And so it's a very limited role. I saw the need for more support, and I was looking for something that would allow me to use my bilingual skills as well as, be of help in the community.
My name is Shandy Potis Mangra. I am the CHW Workforce Development Program Manager for the Minnesota Community Health Worker Alliance. Community health workers work across a vast variety of workplace settings. They are being integrated within healthcare teams, as well as within other organizations such as public health teams alongside public health nurses. With community-based organizations, they might be working in various settings, helping and assisting, providing in resources, health education, health promotion.
Our CHWs work across almost every team in our department. So from family home visiting, they work with the nurses to home visit to individual clients and address different social determinants of health, healthcare access, resource needs, as well as education. Our community health workers are car seat technicians, and they can provide car seat education and actually bring out car seats to families who qualify. We also work with our aging initiative through a falls prevention program with our fire department. So if there's frequent fallers in the elder population, they will get a phone call if they agree to ask questions about the state of their home, resources they have in place, and we can send out information to them to make them more safe in their home. They also work with our refugee population. We have a refugee health program here, and every new refugee will get a public health nurse and a community health worker in order to address needs such as how to navigate our medical system, how to use medical transportation, and other resources they might need. We also can help with direct observed therapy for tuberculosis patients, as well as other resources through our community outreach. We work with the Child and Teen Checkups program to make calls to new enrollees onto medical assistance, ensuring that families have access to a medical provider, as well as are aware of all the benefits that come with their medical plan.
As an interpreter, when I would, in an encounter, notice a need in the community, or from a patient, I was relying on providers and staff to connect our patients to additional resources, and sometimes there was a gap in that. And so, for me, I wanted to be able to give those resources, but my role as an interpreter was limited. And so I started to look into a role that would allow me to explore the passion that I had to be able to help more.
The CHWs at Dakota County Public Health are doing a lot of services in the community that directly connect to the individuals in the community, but also provide direct impact in the days that they are supporting. For instance, we have community health workers at Dakota County Public Health who are going into the shelters as well as into the food pantries. We are seeing that obviously those individuals are able to leave with food support. They're able to leave with resources as well.
My name is Marguerite Warding, and I'm a community health worker here in Dakota County for 22 years. I start here in the county helping the families. I do home visits, I do car seats, I do bring some food for families who really need food. I go to a lot of fairs and give information.
Nicole Tyrell. I am the neighborhood program manager at the Open Door Pantry. We are seeing an increase in need in the communities. We're serving between 23 and 25,000 individuals per month. And about a year and a half ago, we were serving about 17,000 individuals. So increased need. We're finding that folks that are on fixed income are also seeing an increased need with cost of food prices going up. So we're just trying to reach that any way we can and finding unique partnerships to be able to get food out into the community. The partnership with community health workers has increased over the years. We're finding new, unique ways to get food to those workers because they have a direct line into the folks that need the food the most. So we are currently partnering with the community workers to come to some of our mobile home communities. They are going to schools. We have a pop-up once a month at Dakota County Northern Service Center where we serve between 400 and 550 families during that time period. So yeah, it's just a continuous partnership. They're coming here to our pantry to grab food to bring out to individuals that cannot leave their home for whatever reason. And yeah, just kind of ever-growing partnership of just meeting the need where people are.
Mi nombre es María de la Candelaria Ríos Cruz. Me conocen como Candy. Viene a vernos a todo lo que necesitemos. Y si necesitamos pues un papel como llenar, ella nos ayuda. Con las aseguranzas de los niños, ella nos ayuda. Todo con comida viene, nos trae comida a la puerta. Pues yo sí recomendaría, ¿verdad? Porque sí, hay a veces que uno se le complica como no saber hablar inglés y necesita uno que nos ayude, que nos guíe qué es lo que está bien, qué es lo que está mal.
The Minnesota Community Health Worker Alliance is a statewide nonprofit supporting the profession of community health workers through professional development, convening of peer support groups, as well as providing resources to allied professionals, CHW supervisors, and CHWs as well. There are workforce shortages throughout Minnesota when it comes to our healthcare system and in social services. And we know community health workers are essentially a profession that can help fill those gaps. An environmental scan that came out in 2024 found that there are over 1,300 CHWs that have received their community health worker certificate from higher ed. 47 of 87 counties in Minnesota currently have CHWs employed. That's about 54% of the state. There are over 880 CHWs currently working in the state of Minnesota across various workplace settings that include behavioral health, long-term care, public health, community-based organizations, and many, many more.
As a community health worker who's worked in various sectors, including public health, our clinics, our hospital systems, our mental health provider clinics, I've been able to assist community members with the needs that are unspoken. We might go into the home and discover that there is a falls risk for the individual. And what we can do is begin to build a relationship, and that individual comes out and tells us that, yes, I am struggling, I am off balance sometimes, and I've fallen a few times. Well, that's not something that the doctors probably knew. That is something that now I can be the vessel for two-way communication and carry that information back to my team and help this individual connect with supports that would help him to be safe in the home.
The priorities might look different for individuals and the families that CHWs are serving. And we bring that back to the healthcare team so that they recognize what the barriers and challenges might be to helping them meet their health and wellness goals. Because the priority right now, especially given unprecedented times, It could be more of a need for safety and security in their neighborhoods. The challenges that our community health workers are facing is challenges around being able to do their work in a way that aligns with the ways that healthcare systems work and operate. Oftentimes there's a crunch in terms of the time length that you have to meet with individuals and community members. But for CHWs, we recognize that that doesn't work for the work that we do in terms of building trust with the community, requires time.
More and more doctors, nurses, social workers, and mental health providers are understanding that the community health worker role is one that supports their everyday role as well, allowing them to have the time to work at the tops of their professional licenses.
Community health workers want to feel like their roles are integrated within their organizations, that their ideas and their feedback matter, and that they're receiving the support essential to the work that they're doing on a day-to-day basis.
My Dakota County supervisor actually has been amazing, providing the support that we need. I mean, not only that, but giving us the freedom to have our own voice and being able to have input and the decisions that are made within our department. The final goal, I feel, is to make us feel that we are part of a team. We're not just a worker. We're not just trying to bring numbers up. We are part of the team, and we try to work together for the benefits of our community members.
There should be a lot more CHW. I cannot stress that enough. They are the bridge to the community for sure. It's important that every community member have an opportunity to learn about the resources and services that is provided for them through the county.
My role as a CHW is important to me now more than ever, because of the barriers that our communities face every single day, because of the social determinants of health. Ultimately, our goal is to be able to empower our community members.
Thank you, thank everybody, and thank you all for all that you do, because it's a purpose to what you guys are doing. Keep telling people, keep going out and giving out this love, because y'all came with a smile, you wasn't scared to talk to us, and so that's why I'm so comfortable. Thank you all.